right, welcome back. And it is that point where we discuss matters health. Today we're doing it outside, and well, I can guarantee you it's going to be worth the while. Yes, and this is Morning Cafe Health Edition or Health segment as we discuss matters health. And today we are at the Pelvic Center or the Pelvic Floor Neo Control Center. You probably could be asking yourself, what about that? Why not? Because then in a few we'll have Dr. Alice Nyambura to take us through what goes on in this particular beautiful sport. It's beautiful because every time that we're talking health and you know the remedies that will come along with that, it is beauty. You can imagine you have a condition, you probably are scared of how you're going to deal with this, and then boom, you're being told that, visit the Pelvic Floor Neo Control Center. And once you're there, all your troubles will be solved. And true to it, such happens. It is beautiful. And in my little chit chat with Dr. Alice, she tells me that, a couple of, conditions that would appear as though, those conditions that you don't want to speak about, in public because you kind of feel like, they're a bit too, private, they're a bit too intense. You don't want to speak about them. These conditions are fixed when you visit this place. So she'll probably be telling us what the Pelvic Floor Neo Control Center deals with, and then we'll get into the nitty-gritty details of some of the conditions that will be helped on, of course, when you come to this place. But importantly, we first understand what it's all about. Good to have you.
Thank you.
Asante sana for inviting us.
Karibu sana.
Actually, it should have been you telling us good to have us, right?
Yeah, karibuni sana.
Asante sana, tunashukuru.
Karibu sana to the Pelvic Center. My name is Nyambura Alice. I am a physiotherapist and more so a specialist in pelvic floor conditions.
All right.
Yeah, and this is the Pelvic Center where we deal with the pelvic issues. Anything pelvic area.
Anything below.
Anything below the belt.
Right.
Those issues are the issues that we deal with. Most of the pelvic floor muscles, the dome shape area. The Pelvic Floor Center deals with a new technology that is called the EXEMI. EXEMI in full means the extracorporeal magnetic innervation. Okay. Is a new innovation into the country. Actually, I can proudly say that we are the first ones in the country.
All right.
Yeah, in Kenya.
That's good.
Second in Africa. From South Africa.
Nice.
And 60th in the whole country, in the whole world. Yeah. So, very excited about it, very excited to introduce it to the public, to solve these issues that a lot of people feel like they are not comfortable to discuss. The issues of pelvic floor are hidden, so a lot of people are able to hide them.
That's true.
You
die.
Yeah, you die with them. Yeah. It's not like when you get the paralysis of one side, everyone sees you're paralyzed and you have to seek help. These issues are hidden, so a lot of people hide them. They hide the issues.
When you say that you are the first ones in the country, then
Yes.
for a moment I'm thinking, well, at least we've had these conditions in existence before. So what happens, or what used to happen to these, patients who go to hospital and then they probably are diagnosed and they're told that you have, a pelvic floor, disorder. What used to happen to them?
They still would get treatment, yeah? We have the urologist, we physiotherapists,
right.
And we would use other technologies.
Okay.
Yeah,
so this one is a bit advanced?
So this is advanced.
Okay.
They would still seek help, like, for instance, a patient or a client comes with incontinence. Incontinence is when you cannot control urine or the fecal matter. You see, that is incontinence. So it might be fecal or urinary.
Right.
So you are sent to a physiotherapist. Initially, we would actually use some probes. Yeah, we use a machine we call the TENS, transcutaneous electrical nerve stimulator, and we would use the probes to put inside there, and it used to be very, very uncomfortable. It's very uncomfortable, but this technology is non-invasive. There are no probes, and it's non-surgical, and it's not painful at all.
Can you paint
Very
a picture
decent.
of what to expect when you're coming here? How decent is decent? Oh, we're going to go through
Yeah,
that?
we're going through. I'll show you.
All
Linda,
right.
I'll show you.
Okay.
Yeah,
well,
just
I'm
hold your
excited.
horses.
I am holding. I am patient. I'm a patient girl.
Yeah, I will show you.
So to start us, I think it's only fair then that we understand the pelvic floor. Now that you say you are, we're going to be handling, conditions that, fall under this.
Yes.
Just what then is pelvic floor all about?
Yeah. So the pelvic floor, is that dome shape area, yeah, around the pelvis, yeah?
Yes.
From your pelvic bones to the tail, the bone tail down there.
Okay.
You know the bone tail down
Yes,
there?
yes.
Yeah? That whole area, the dome shape, is the pelvic floor. Yeah? It's another diaphragm. You see we have the chest diaphragm,
Right.
which holds the heart, the lungs, very important organs, yeah? The pelvic floor also holds very, very important organs. It holds the bladder,
Right.
the uterus, the urethra, all those very, very important organs down there.
It's a typical organ support
Yes,
system.
yes, exactly.
Okay.
It works like a hammock. You know a hammock?
Yes.
Yeah, where you hang there. So if the hammock is weak, you drop.
Right.
You get it?
Right.
So that is what the pelvic floor muscles do. They hold all those important
Right.
organs. Most people will not be able to identify the pelvic floor
Yeah.
muscles. So when you come to me as a physiotherapist, the first thing I do is to teach you how to identify your pelvic floor muscles.
Okay.
You have heard women being told, go and do the Kegels exercises.
Yes.
A lot of women know about the Kegels exercises. Those muscles that do the Kegels exercises are the pelvic floor muscles.
Okay.
And some people would tell them that when you go to the lavatory, when you're passing urine, some of them tell them you try and hold.
Yes.
So those muscles that hold, or
Okay.
let's assume
I'm
you are,
literally holding
yes,
right now.
good, thank
Okay,
you.
okay.
Or when you're in the public, yeah, and you're being a bit messy,
Yes.
and maybe someone you respect passes by when you're trying to, especially the men,
Yes.
like standing on through the sides, yeah. So when someone comes, you might hold, you know.
Yeah.
And it comes so naturally,
Right.
yeah, because you have what we call the sphincter muscles that hold it. So those are the pelvic floor muscles. Maybe I have to group them into their uses.
Okay.
Yes, I tell you the uses of the pelvic floor muscles.
muscles, all right.
The first very important use of the pelvic floor muscles is the support. We have already discussed it.
Right.
Yeah, this support.
The organ support.
Yeah, the organ
All these
support.
organs.
Yes, all
Alright,
these
that's a good
organs,
one.
yeah,
Right.
supports the organs and helps them not to collapse. And when your pelvic floor muscles are weak, that is when you start getting your uterus prolapsing.
Okay.
Yeah, a lot of women have had it, and especially after giving birth, you get a uterus prolapse because your pelvic floor muscles are not strong. You start feeling some heaviness down there. Yeah,
Okay.
it can be as bad as when they touch, they can actually feel it.
them.
Yeah, because it's weak. It also helps to support when you're having a pregnancy.
Okay.
Yeah, it will assist you in supporting your pregnancy to term. When the pelvic floor muscles is very weak, we have so many reasons why we have abortions. We get abortions, yeah? And this is one of the reasons. Because you might go to the hospital, you do all the tests, you do the ultrasound, they check your hormones, they check everything.
You're not able to
Everything is
support the
correct.
baby.
And they're not able, you go to the lab, everything is okay.
So they give you an option.
So they
of losing
wonder
the baby.
what the problem is, because you keep on, your pelvis opens up early before time.
Okay.
It's because, so when you do a proper test, you will come to discover that the pelvic floor muscles are weak.
Weak.
You're getting?
Yes.
The second most important use is the stability. Stability. Like now the way you're seated,
Yes.
you are stable. Yeah?
Okay.
You are stable.
Right.
If your pelvic floor muscles are not strong enough, you become unstable.
Okay.
Yeah, because they're the ones which support that area down there, including other muscles outside here that we're not talking about today,
Okay.
but they offer support, which is very important, so that you will find a lot of people when they don't have that stability. Like when you're waking up in the morning, they have some pelvic pain. When you're walking down there, you have some pelvic pain because you are not stable. There is some instability deep down there.
Okay.
Another very important function, and I think this is very, very important,
Okay.
sphincteric function.
Okay.
The sphincter. The sphincters are those muscles, like, let me give an example of the eye. When you're able to do that, to
Right.
hold it, that is a function, sphincteral function. So down there, when you're not able to have that function, that is when you start leaking urine. Now you can't hold your urine because your sphincters are not strong enough. There are people who will just pass gas without control. Actually, if you have used the buses to travel, maybe especially at night, especially at night,
it is stuffy in there.
It is stuffy in there.
Yes.
And when I went to college, when I went to school, is when I realized that sometimes it is not out of their doing. You'd hear everyone open the windows, you know, that kind of a thing. And maybe that person is over there feeling so bad that he is the cause of all this stuffiness.
Right.
Because gas is just passing, you know. And then you think how you will hear some people say, let me say in Kiswahili, watu wengine hawana adabu, wanafanya nini. And that person is sick, you know. We know some people can be not here, but some is because they are sick. Then when you're traveling, some people have to travel while they are wearing pads because they will leak urine. You don't want to go to parties. You don't want to do any activity that, like jumping or anything, that will make you strain your muscles. Because you try to laugh, even when you go out with your girls, you can't really laugh and let it be. Yes, you can't laugh comfortably because your muscles are weak. You laugh comfortably, you leak.
Oops.
So what it does, it brings your quality of life down.
Look, before we even get to know, you know, the other functions that are there, I think I want to understand just how prevalent or just how common, you know, is this situation in the country. I'm calling it a situation because I don't know whether it's a condition or what. Yeah.
It's a condition,
It's a condition, actually.
Yes,
yeah?
it's a condition.
Right. So how prevalent or how common is it?
The prevalence is quite high, but the problem is a lot of people keep quiet about it. Especially a lot of women suffer from incontinence. Linda, I will tell you, when you walk to the malls, some women cannot be able to get to the bathroom.
That's true.
Yeah? And most of them will leave their undergarments there because it is already wet.
Right.
And you don't want to go smelling urine. You would rather go without the undergarments, to avoid the foul smell. So a lot of women, and not only old, some people think kina shosho are the ones who are having those issues. No. As young as 20 plus are having incontinence issues.
Right.
But the biggest problem is they keep quiet. And we always say, don't keep quiet with your issues. It is not your mistake that you're leaking. You need to seek help. You need to go back to your life. You need to be happy. Yeah, a lot of people even get divorced because of these issues. So we are calling upon the women, especially who have these issues. Get help. The help is there, actually.
All right.
Yes.
Why do you mention women, you know, more than men? It appears like this is more of a woman's problem, you know, condition than, you know, male condition.
Linda, being a female, when it comes to issues of pelvic floor muscles, is already a risk for you.
Man.
Yeah? This is especially because we carry the pregnancy. Yeah? We are the ones who put weight during pregnancy, on our pelvic floor muscles.
All right.
Men too suffer from incontinence. You have obesity, you have other conditions. They have prostate. Yeah, male too suffer from it. But the biggest percentage is the woman. I also don't know whether it's because of even some of the duties women do, or what, heavy lifting or too much lifting, or I don't know. Yes, but being a woman is a risk by itself to having pelvic floor conditions. All
right. Well, we, in a few, will probably engage Dr. so that she can tell us what are some of the causes where, you know, in a scenario you get your pelvic, you know, the floor dysfunctioning or damaged in a way. But before we even look at that, more functions to this?
Yeah, thank you.
All right.
So another important function of the pelvic floor muscles is the sexual function.
I know you want to listen to that. Men, women, this is key.
This one involves both the man and the woman, the sexual function. Linda, I remember, I've never forgotten that statement when I was I joined my Form 1 some years back. I remember my CRE teacher, and you know, we were so innocent and small, and I was like perplexed. And she said that sex is a gift from God.
It is. That's why I said I know everyone here is like on the last.
Yes, it is a gift from God. It is a very, very important function that God gave us. We wouldn't be here.
That's true.
If it was not for that function, for creation, for pleasure.
Right.
Yeah? For all that. Actually, there's a singer who has said that mostly you don't marry because of children, you marry because of pleasure and love.
And love.
You get it?
That's true.
So if this is not working, that is where you hear a lot of people saying that when you see people going in traffic and they're not talking to each other, maybe that function is not very functional.
Yeah.
There are some problems. So your pelvic floor muscles are the ones that gives you that pleasure. Unfortunately, sometimes they are weak and loose. The same way our skin can loosen. Yeah? And that is why you take very good care of your skin. We have the same kind of tissue down there. Yeah? That is where you'll see someone pulling their skin and let it go back.
Sure.
That is how our muscles are. They have what we call elasticity.
Right.
They can stretch and go back. That is why you give birth to a big baby and you go back.
Okay.
Yeah? No one would ever say that because she gave birth to a big baby, she's not as pleasurable as the one who gave birth to a small baby.
All right.
But sometimes you have trauma, during that birth, leading your muscles to weaken, age, and so many other things. So when you have that function of sex might not be pleasurable because you all understand what happens during that function. So that is when we say we are here. We try through our eczema technology, we're able to tone back your muscles.
Right.
Yeah, we tone back your muscles. Unfortunately, there are people who would try to put very funny things inside there, which might damage your function as a woman.
They're sold all over.
Yeah, they're sold all over.
You get excited.
Yeah, and women get excited because you want to give pleasure to your partner. So a lot of women would seek the wrong kind of help instead of seeking the right kind of help. So when they are weak, Linda, there are funny things that might be happening for you to know that there is a problem.
There's a problem, yeah.
Gas will be passing through the wrong sides.
The process of intercourse.
You know the way we were born, We were born, you're supposed to pass gas through the rectum.
Right.
So during the process of intercourse, some people will be passing gas and sometimes they even produce very funny sounds. Yeah, and most people would think that it's normal.
Okay.
Yeah, during sex, there are funny sounds coming out. Someone is passing gas. You might think they are farting and it's through the wrong places. It clearly shows your muscles are weak. That is why they are allowing air in, air out. But when your muscles are strong, and please note, not women say they want them tight. That is the wrong term, Linda.
It's not tight, it is strong.
A strong muscle is a muscle that is able to relax.
And hold.
And go back.
Okay.
That is a strong muscle. Otherwise, a tight muscle, take for example, when you have a burn and you have a scar, your muscle becomes tight.
Yes.
So it can't stretch.
Okay. So then that's not even fun.
Yes, it's not even fun. And that is when you start having painful sex.
Yes.
Yeah? And some women just have those tight muscles. So they hate sex because it becomes painful. Yeah? So your muscles need to be made to be strong so that they're able to move, to relax. Yeah? And that is why you're able to sit and have your bladder is full and you're still relaxed. That is why you're able to go to the toilet and relax your muscles to allow the urine to go out. Yeah, because you have control. The control. It's the same thing that happens during that pleasurable moment. You are able to control your muscles and the more pleasure. Actually, I will tell you this, Linda. A lot of women do not know what is an orgasm.
True to it.
Yeah.
Because this has got something to do with having a proper pelvic floor?
A proper pelvic floor muscles, and definitely even your partner, the kind of partner you have, it will matter. Okay. But you might have the right kind of partner, but you're still not.
You're still holding.
You're not able to get there because you have a problem. Because you have a problem. Maybe your partner is trying all the best. They want you to get that cloud 9, but you can't get there.
Okay.
Yeah. So when you have the right pelvic floor muscles, some women would even start experiencing what I've heard them calling aeronosquats or something. Yes. Yeah.
Let's take a short break. Because this is going to be helpful for you. It is important that you check Dr. out. I know how important this subject is to us.
It is very important.
In as much as we'd say it's watershed period, I'm sorry, but we have to discuss some of these things. If you have this problem, go out there and speak to the broadcast. We are discussing the importance of having your pelvic floor muscle in order. And with me in studio is this in studio? Actually, we are on location, so we have Dr. Alice Nyambura, who's hosted us this morning, and we are discussing this important subject, that pertains to you just having, all the functions that we have earlier mentioned are, in order. And it's a bit of a tongue twister for me because they are all matters health. But then I realize these are things that we go through on a daily basis. We have our women struggling out here, but they do not want to speak. A scenario where you're passing urine and you're not able to control that. What Dr. has just spoken about, that aspect of, enjoying that moment of intercourse and, having, the breaks that we all want at this particular point. Really, really important subject that I can guarantee you, if you stick around, if you're just joining us, will be of great importance to you, and you'll have picked a great lesson. And if you know someone who's probably going through some tough times, then you can always advise them to speak out and, refer them probably to the Pelvic Flow Center right here in Nairobi. So back to you, Dr. And we still are discussing the functions of the pelvic floor muscle, which is really, really important, I realize.
Yes.
Any more?
Yeah, I think we still have one more function that we didn't mention. That the pelvic floor muscles are also used to pump blood back. It's called a sump pump. Yeah.
Okay.
When the heart pumps the blood to the whole system, like when you're breathing, like remember when you're giving birth, when someone is giving birth, you're told breathe in, breathe out. It really helps in continuous circulation. You need that. And even you're told when you're doing some function, don't stop breathing. Keep on breathing, even when you're doing the pelvic floor exercises, you're told don't stop breathing. So it is the one when you breathe, when the diaphragm pumps out through the lungs, through the heart, the lungs, to the other parts of the body. Also, the pelvic floor, they help to pump blood back.
Right.
The same thing, we also talk of the calf muscles. It's called the second heart. Yeah, like even when your legs are swollen and all that, it is there that helps to pump blood and any other fluids back to the system.
Okay.
So that was a very important function that we would not forget. And when your blood is not circulating well into your body, it brings many, many other conditions. So it is very, very important. Yeah, when your blood, that you have a proper blood circulation. And this happens when your pelvic floor muscles are strong enough.
Oh, good.
Yes.
You probably were thinking it's just about the aorta. You used to call them the aorta and the arteries.
Yes.
It's not about that.
Yes, it's just not about that.
There's more to that.
Yes.
All right, Dr. So, after mentioning the functions of the pelvic floor, for a moment, I am keen as a woman, and I'd want to be more careful from now.
It is important.
Forward, so that I do not find myself in a scenario where I'll have a dysfunctional pelvic floor. So in this case, what are some of the causes so that I am keen and I'm able to protect myself?
Okay.
Of, having a pelvic floor that is not, functioning well.
Okay. We have a lot of causes. A lot of causes. Like one simple cause is being pregnant.
Oh, no, that one you can't control.
That is why I said being a woman is a risk.
It's a risk. Yes,
by itself. So one of the causes is being pregnant. Yeah. So sometimes it might strain so much on your pelvic floor muscles. Sorry. And especially if they were not strong enough. Yeah. They get more strained. So we also have other causes like obesity.
Okay.
And that is where I was saying even men, they are still at a risk of having weak pelvic floor muscles. Yeah. A lot of weight is just bad for anything, for your knees, for your back, for your pelvic floor muscles. Obesity, they are called the non-communicable diseases. So obesity, heavy lifting. When you heavy lifting, people who keep on lifting heavily, you strain. You've seen you can do it practically.
That's
like
true.
Which muscles are you straining? Is the pelvic floor muscles that you're straining.
Okay.
So we are not saying lifting is wrong. But we as a physiotherapist, we always teach you on proper body mechanics. Proper body mechanics is how you sit, how you lift, how you go down, how you do everything. you
how
know,
heavy it is that
how heavy it is.
What is
yes,
this that you're lifting?
and that is why you see we start from lightweight, I don't know, heavyweight and all that, because you're
the
still
limits.
building your muscles. You're still
Okay.
building your muscles. You can't collapse. And it's the same thing when some people would get a prolapse, a disc prolapse, because of just heavy lifting. And we are the same people who will teach you how to lift well so that you don't get such kind of a thing.
Okay.
Yeah. We are the same people who will also teach you how to strengthen those muscles to keep the discs in place. So it's the same thing. Yeah. We are still the same people who will teach you how to keep your pelvic floor muscles strong.
Okay.
We still have so many other causes like constipation.
Yeah. Okay.
You know what happens in constipation?
Then you have
you
to
strain.
struggle and strain.
You strain, you strain.
Okay.
So when you're straining the pelvic floor muscles. You keep on straining. And that is even where now hemorrhoids again come in.
Okay.
Yeah? So hemorrhoids come in because you have constipation and because you're straining. So they all go hand in hand. Some medical conditions like diabetes, hypertension.
Okay.
Yes. So there are a lot of things that cause age. Sorry, I forget.
Oh.
I forgot.
Okay.
Age is also one of the causes. In fact, you will realize a lot of people would tell you like they don't understand. Some even think their old parents are doing it intentionally. You know?
Yeah.
Because they say they like mom or dad does not want ataki kwenda choo.
Yeah.
Ati squeezy ataki amekuwa, you know, sometimes they don't feel like walking around.
That's true.
And it's because maybe they tried to work. By the time they were going, it's called functional. It's called functional incontinence sometimes. Yeah. They want to get to the toilet and it has already dripped. So they think they're refusing, but it's age. Okay. So age. And then we also have, when you have the prostate, you know, it presses on the bladder. It's taking some space of the bladder. You also have some tumors, cancers. So the causes are so many. There are so many causes of this incontinence.
I realize there are others that you can, you know, just make sure that you do things right and you have protected yourself.
Yes.
In this case, then I'd love to know food. Now that you mentioned constipation, you mentioned something to do with obesity. I'd want to assume that you have
Linda, sorry. I also forgot something very important about traumatic childbirth or prolonged childbirth. That is so important, really important, because actually that is where a lot of these issues also come from.
Because you can actually carry your pregnancy so well.
Yes. Then you had a traumatic or a prolonged one, and you know all that. And that is when you're giving birth, you will always be told, push. You're encouraged to push. Push. Which muscles do that? It is the pelvic floor muscles that do the pushing. When your pelvic floor muscles are not strong enough, well conditioned, you will have a problem. Definitely. You will have a problem. So, and I don't know whether it's because of our kind of lifestyle nowadays.
Great.
We don't walk. You know, walking is also an exercise that for the pelvic and all many others. It is an exercise.
Right.
So we don't walk, we sit. Like now we are seated. From here, maybe you'll still go and sit and continue making your notes.
That's true.
So you end up having very weak pelvic. And that is where our parents would give, like you hear a woman has like 15 children. And they're okay.
And they're okay. That's
nowadays,
true.
very, very young girls or young women are having these issues. Then you're wondering, what is it? It's because of a kind of our lifestyle. Yeah. So when it comes now, you giving birth, your muscles are weak and you have a lot of struggle with it. You injure yourself, you injure the baby because of the weak pelvic floor muscles. It's a very important organ, really.
It is
very
really
important.
I mean, from
brings forth life.
That's true.
Yes.
I agree.
Yes.
All right, so that aspect of food, because most of the conditions I have discussed, you know, on set, the doctor, you know, the specialist will always wind up by saying whatever you eat is very important. I'd look at obesity as also, you know, a condition that would be caused, you know, by how indisciplined sometimes you are in terms of what it is that you're eating, in terms of failing to do exercise and all that. And now that you say exercise is really important, how important is food in this case? Food
is equally important, Linda, as you've talked of obesity.
Yeah.
If you're not observing your diet, you will have obesity. Yeah, if you're not eating the right, a well-balanced diet, you will suffer from so many of these conditions. All these conditions we've talked about. You're not eating right, you're not detoxing your body, you're not taking care of radical elements. So when you get these cancers because you are eating wrongly, you get these tumors, it brings you to these problems. So generally, a proper balanced diet is very important. You will not be told eat particular foods that they will strengthen. Just eat a well-balanced diet. Take care of your weight, exercise, and you're good to go. Yeah.
Okay. Sometimes we're very quick to probably get worried, judge, assume things. How then do I know that my pelvic floor muscle is working optimally?
Thank you. So it is almost the opposite of the things
you were saying.
That we've mentioned. Yes, almost the opposite. Yeah. So Linda, you are out there, outdoor activities, and you're told time to exercise. Then you jump up and pee comes down.
Okay.
The moment you land down, there is some pee. When you laugh hysterically, there is some pee. Some people even when you lift.
Yes.
When you lift, you find like there's some pee coming down there. When you're not passing gas wrongly down there, you're able to hold gas down there. You're in public, you have to have the manners to wait until you go in the proper place to do that which is you want to do. So when you're not able to do that, that is when you start realizing you have a problem. During the sexual intercourse, when you're having those funny sounds, from the wrong places, then you also know you have some problem. Having that pelvic pain, like when you wake up in the morning, try to do some position, you're feeling some pain, you don't know where the pain is coming from. You could be suffering from weak pelvic floor muscles. So those are some of the signs that you will experience. Having what we discuss is the opposite of what will make you know that you're having those issues. Yes.
All right. Seeking professional help, because treatment is really important.
Treatment
I am curious.
Really
this
important.
is actually what I'd want to ask. At an old age, now that we say there's treatment and there's help, someone who's old, can they get the treatment?
Yes, of course.
All right. So let's get to the treatment bit.
Yes. So anybody can get that treatment, because what is happening here is your muscles are weak. That is the pelvic floor muscles. Actually, as I told you, we are dealing with strengthening those muscles so that they do the function that they do properly. So I always tell the old, being old should not be a disease. You should enjoy your old age. Some people say niuze. No.
Should not be reasons.
It should not be reasons for you not to enjoy life because you are old. Who said when you are old you're supposed to be sick? No. So when you're old, that your mzee, after he has gone and has had a prostatectomy, bring him to us. Bring him to us. We strengthen those muscles. A lot of those our old men, after that surgery, you will find that they have that, they start leaking some urine. Because the muscles are weak. And after most of those surgical procedures down there, I didn't even mention that. A lot of surgical procedures down there, most of the people will start leaking, So there is help. There is help. You will come. We identify what exactly is your problem, what caused the problem. There are some examinations we do to determine how strong, how weak your muscles are. Then we will start you off. The first thing we do is we do an examination. We give you a home program, and we also set you on our equipment, and we monitor you closely. Like if it's a woman, maybe they were using a pad. Sometimes you will know I use 2 pads in a day, because there are women who are on pads throughout the day, 24/7. You can imagine, bringing about even infections. Actually, infection is even one of the causes of weak pelvic floor muscles. So a woman is on wearing those sanitary towels 24/7. So you start monitoring. Today I was able to wear only 2. Now I'm wearing 1. That is how now you start determining that I am getting well. Everybody should seek help, Linda.
That's true.
Everybody should seek help. For you to get back to the quality of life you need to. Yes.
I'm asking this because this is a random I don't know whether it's a myth, but it happens, and I don't know how to phrase it in English. But there are numerous occasions where you're told, you know what, you need to control your muscles, especially when you probably you feel like you want to go out there and pee or susu.
Yeah.
And, you know, someone tells you, jikaze. Is there anything wrong with, you know, you overdoing it? Like holding your muscles for quite a long time as opposed to, you know, going out there to ease yourself?
It depends with where you are. But when nature calls, respect it.
Okay.
Yeah. If you need to go to the ladies and it's and you have the ability to go. Yeah. Because nature is calling. Do what nature is telling you to do. Go and do it. Don't overstrain your bladder. But sometimes you are in the wrong places. You are in a bus.
Yes.
Yeah?
You have to hold your
yes.
feet, yeah.
You're having, like, even now, maybe when you're doing this show, you know, you have to hold.
You have to hold for 45
minutes. Yeah, you have to hold for
minutes.
45
Yes,
minutes, yeah? And that is where that function is very important, yeah? When you are not able, it's actually a disability. Because if you cannot be able to hold, then you pee on yourself. You know, that is a disability. That is a disability. So when you want to go to the toilet, go to the toilet. But when your muscles are strong, you can hold a little longer.
Wow.
Yes, with a lot of decency.
That's true.
Yes.
You know what? From this session, then I realized it's important to speak out. I repeat, I have said this like thrice, and I think I'll say it again. It's more expensive not to speak out.
True.
It could be very uncomfortable not to speak out. You could look at it as though it's an expensive affair to probably try this new therapy, you know, kit that is in the country or landing in the country for the first time. But maybe it will save you a lot more. True. If you try and seek help. What are some of the difficulties and conditions, now that we've talked about the functions, what are these uncomfortable conditions that would come along with one not having a proper pelvic flow? For instance, you speak about, passing urine anyhow without knowing, passing feces without knowing, without control and everything. Any other?
Any other?
Yes. Any other condition that would come along with not having a proper, pelvic flow? Health condition, for instance?
It's the same conditions we discussed about.
I want us to be specific because the reason why I'm doing this is because I want to come back again. And I want to come back again and understand, urine, you called it urine inconsistency?
Urine incontinence.
Incontinence,
it's,
yes.
It's urine
I want to understand that.
Yes.
And I want to understand that would come out of it. Probably, the male specifically, fistula. For instance, would it come out because, or would one get fistula because of pelvic flow? Are there other health conditions that we can clearly pinpoint and say, this is as a result of not having a proper, a pelvic flow?
Yes. Like in cases of a fistula.
Yes.
This comes due to the same condition I've talked of, traumatic or prolonged, childbirth. So when your muscles are not so strong, you strain so much until you end up getting that fistula.
Yes,
you get it? Yeah? Or other conditions like FGM. FGM is one of those causes that lead to weak pelvic floor muscles, then it becomes vicious. Again, when you're giving birth, now you get the fistula,
Yeah.
So it is a condition. Your muscles are weak. You go to FGM, you get a cut. Brings you to having problems with your pelvic floor muscles. When you're giving birth, you get the fistula. So it is a vicious circle. Right. And all the others that we've talked of, like obesity, we've talked of constipation.
These ones would be causes too.
Yes, causes
but also
too.
This then the condition will cause something different.
Yes, exactly. So the same condition, constipation, weak pelvic muscles, obesity, hypertension, poor lifting. All those, yes, all that.
All right, you know what I pick? I pick fecal incontinence and urine incontinence. I think I want us to discuss that next week.
Okay, no problem.
We will.
Shall. Yeah, it is actually one of... Yes.
Yeah, so this is one of the conditions that, would be as a result of you having, a pelvic floor that is not functioning well, that is not proper. And so maybe next week we also get a chance to see the practical aspect of it, just to see how these machines then would come in handy to make sure that you are treated and you are having a pelvic floor that is functioning well. Thank you so much, Dr. Nyambura.
Thank you, Linda, for having me.
Thank you.
It was my pleasure to educate the community.
Pleasure is always mine. Speak out.